Good evening, everybody, and welcome to the New South Wales Family Daycare Association webinar in the PD in Your Pocket series. I can see lots of people logging in, which is fantastic. So before we begin, I would like to acknowledge the traditional owners of the country on which we meet today. I know we are on many different lands with many traditional owners, but New South Wales Family Daycare Association is presenting this webinar from the Gadigal country. I would like to acknowledge Indigenous people, past, present and future, and any Indigenous people that join us this evening. We'd also like to recognise that 90% of COVID patients in the Northern Territory are Indigenous, despite Indigenous people being only 30% of the population. Unfortunately, like with so many other diseases, the impact of COVID has been higher on the Indigenous community. Before we begin, I'd also like to have a chat about the future of PD in Your Pocket. So remember that all those fantastic booklets, recordings, further readings, podcasts and videos are still available on the PD in the Pocket website. There's lots of fantastic sessions that you can go through if you missed any, and we really want you to utilise those fantastic resources as much as possible. You can rewatch them or catch up on any that you may have missed. We're very much hoping to obtain another year of funding from the department for another great year of PD in a Pocket. It's been very popular within the sector and it's been really helpful to all of our family daycare educators. So fingers crossed we can get another year of that for 2022, and we will certainly keep you updated on how that goes. So New South Wales Family Daycare Association is providing this session because we know that educators are increasingly concerned about being impacted by COVID. And that may be whether they themselves test positive or they're concerned about keeping the children and the families safe. And maybe also what will happen to you financially if you must close. So we're going to concentrate on 5 main areas. The what? So what do our governments want family daycare services to do? The how can you stay safe as an educator? How can you keep the children you care for and their families safe? And what financial support is available for families and educators? And finally, how to plan for someone in your service becoming COVID positive. I would now like to introduce Lisa Bryant, who will be our presenter for this evening. I'm sure most of you know Lisa from previous sessions. Lisa is an early childhood education and care consultant. You're getting a lot of hellos, Lisa, in the chat box. And we're really grateful for your time this evening, Lisa. So welcome.
Thank you. I'm glad to be here. So I'm going to take over from Elizabeth now and start the session. Can I just start off by asking people to, which of people watching tonight, who has had COVID themselves? If you've had COVID, can you just put, either raise your hand or put a quick note in the chat box, just so we know? I see a few coming up, yes. Has anyone else had COVID? Yeah, so as you can see, a number of people already as educators, as you'd expect when there's such high incidence of COVID in the community, from about Christmas onwards, you'd expect that some educators have had it. Hopefully those of you that have had it are okay. Hopefully you've recovered and you're all fine. I'm sorry that you have had to do it, but I wanted to start with that because I think that we can get a bit complacent about it. We can think, oh, we won't get it, or it won't be so bad if we do get it. But when you see that people in exactly the same situation as you have had it, then it brings it a bit closer to home. So the first thing that I want to look at tonight is, what do our governments want family daycare services to do? Now, what is it that they want us to do? And they want us primarily to stay open. They want every family daycare service, as much as possible, to still be around, to care for children, to enable families to go to work, etc. They want us to keep operating despite the pandemic. And I suppose for a lot of us, that's what we want as well, because it's our income, it's your income, it's your livelihood, and you know how important the care you provide to families is. And so, because both the federal and the state government want us to stay open, then, that's why they've provided the RAT tests, the rapid antigen tests for your service. And that's how why they've changed rules about who is a close contact and what's an essential worker. But what we know above all is that for family daycare services to stay open, then educators have to stay safe. So that's what we're going to start off with, how you as an educator can stay safe. And remember I said that, that we need to remember that people around us have had COVID. I think one of the things that happen is, once you've had it, especially if it's a mild dose, or if your aunts had it, or your uncles had it, or your best friends had it, you think, well, that was probably pretty mild. They weren't that sick. And so maybe it's not as something that we need to be as scared about back in March 2020. Certainly in March 2020, I didn't know we'd still be having these discussions 2 years later. It's horrible that we're still having to have these discussions. But when you think it's only a mild disease, you need to remember that it's not a mild disease for everyone. And even, in the last week, New South Wales has averaged 22 deaths a day. So although it might have been mild for you or for your uncle or aunt or whatever, it's not going to be mild for everyone. And so that's why the aim is for most of us not to get it, and certainly for the children in our care not to get it as well. One of the things that, really kind of clarifies it, I think, about COVID is that it's an airborne disease. So all the tools that we have in our toolkit is to stop that disease from getting into the air, or if it's in the air, it's to stop us breathing it in. And if you think about your various tools like masks and boosters and stuff, and think about which one of those two do they fit into, then it kind of makes it a bit easier to work out which one is the most important at what time. So we're going to start off looking at boosters, right? Now, as you know, all family daycare educators and all other educators in other sorts of education and care, and all household members, anyone in your household that's over 18 must have received 2 doses of a vaccine. If you haven't received those 2 doses, then you shouldn't be operating as a family daycare educator. And the Premier has announced that educators will be required to get a booster shot. Although this hasn't yet become part of law, it will become part of law, he has announced. So unless he changes his mind, that's what's going to happen. But just like with the first time, you had enough time to get it done before you absolutely had to have it done, that will happen again. So they'll put it into the law and then put a date in the future at which you must have had it by then. As all educators had to have their dose by November 8, you're now eligible to have your booster. Someone's just said that they got their booster shot this morning. Good on you. So everybody that is watching this this webinar should be eligible to get their booster, and it's kind of a lot easier to get your boosters now. A lot of chemists have it, most doctors have it, so you can just go to one of those places. Some are saying that they got their booster 4 weeks ago. That's great. So boosters are expected to reduce the risk of symptomatic disease from COVID. So that's, like if you get COVID, getting really sick from it, having a lot of symptoms, It's ATAGI, which is the body in Australia that's been looking after us all through COVID and giving governments and the Australian people advice, are saying that, really it should stop us getting that symptomatic infection, certainly should stop us from getting severe disease if we've had it. There's strong evidence that it suggests that it produces that that barrier to getting really sick from the Omicron variant. So that's why they're suggesting that we have it. Boosters especially, guard against us being really sick when we get it. So the booster, because of that, it means that us being boosted protects not just us, but also the children in our care who, as you know, at this moment can't be vaccinated. I just saw someone asked, what about if you've already had COVID? The current advice, although it's a little bit hard to get hold of this advice, but is don't get your booster for 4 weeks after you've had COVID, but after that, get it as soon as possible. So if we could just go on to the next slide. There's 2 of us running this. I'm not pressing my own slide, so it might not be wonderfully seamless here. I want to talk to people about infection periods, because if you understand when COVID is most infectious and when it's not, then it can help you make decisions about how to protect yourself and how to protect children that you're taking care of, and how to protect your family members as well. So essentially, people are most infectious 2 days before they have symptoms, 2 days before that scratchy throat or that cough or that something that says to them, hey, maybe I've actually got COVID, So 2 days before you get it, before those symptoms, and 2 to 3 days after. And, that's when you're most infectious. It's rare that you're still contagious, that you can still pass COVID on after you've had symptoms for 10 days. So that's why Australia says you've got to isolate for 7 days, right? Because that's, that's the period at which you're most likely to pass it on. Some people will still pass it on after that 7 days, but it drops a lot. I just saw in the chat box someone saying that they have to bury their uncle, and I'd like to, because of COVID, and I'm very sorry, and I'd like to pass on my sympathy to you. It must be a horrible time for you having to do that. Why I want you to understand those infection periods is because it helps you make decisions about, when a child can come back, or when you should not provide care for it. As we go through the rest of the information, just keep that information in your mind. So it's 2 to 3 days before, 2 days before, and 2 to 3 days after. Okay, so one of the things that we're talking about, or one of the things that can protect us from COVID, is the surveillance testing. And the surveillance testing is what the department has enabled all family daycare educators to do. Some of you may already be doing, I hope some of you are already doing your surveillance testing. This is where you do a rat test once or twice a week just to check that you haven't got COVID. Have people started doing those yet? Someone said they do a test every Monday. That's good. I hope you do a second one in the week as well, because the department has provided your services with enough to do 2 a week. So, yeah, maybe Monday and Wednesday or Tuesday and Thursday. Yeah. It's surveillance testing is different than the testing that you were supposed to, that we were initially going to do, which was going to be you test, and if you're okay, then you can keep providing care. This is just a different sort of testing that says, okay, you do the test twice a week and it checks if you've got it. If you're okay, then you can continue providing care. If you're not okay, then, you obviously stop providing care immediately. And it's just a way of checking. As I said, the department has provided services, your family daycare services, with enough to do 2 for the first 2 weeks, and then the department will send more over. At the moment, it's only been planned for the first 4 weeks. And then after that, there'll be another announcement if they're going to continue. I can see a lot of people saying we haven't been given some here, we haven't gotten it from our service, or our service hasn't gotten it. If your service hasn't gotten them, hasn't gotten them. That was bad English, wasn't it? No, I'm a writer. If your service hasn't received them yet, then they should contact the department. If you haven't received them from your service, then you contact your service, because they're there to help you check that you're okay. So what happens if you test positive? Then you have to immediately close your service, and you can't provide care for 7 days, and you have to self-isolate at home for 7 days, as does everybody else that lives with you. So, your husband, your partner, your adult children, your younger children, everyone in the house has to isolate for 7 days. You need to immediately tell your service. You need to say, hey, I've just tested positive on a rat, and you need to tell your families. But remembering that time as to when you were most infectious, you need to tell your families that were with you in the last 48 hours. Now, it may be that you need to tell them, or your service will need to tell them. Individual services have probably told educators, you tell your families, or they might have said, no, you tell us and we'll tell the families. There's a particular letter on the department's website that the department suggests that you or your service give to families. It's important to remember that if you've tested positive, your children don't have to go and test immediately. They only have to test if they have symptoms. Some parents may say, no, they've been with a positive educator, I'm going to get them tested. And I know I probably would do that if they're over 2 years. Of course, you can't do a rat test on a child under 2 at the moment. But a lot of parents may choose to get them to get their children tested, but that they are not obligated to do it. They don't have to do it under the law. And you also have to register a positive result via the Service New South Wales app. So if you've got positive, you've got to go onto the Service New South Wales app on your phone. That's the same app that you sign into everywhere that you go, and you've got to hit the button that says report a positive rat test. Okay, next thing. When you do a rat test, it's really important that you do it the right way. So there's 2 sorts of rats. The ones that the department sent out to everyone are essentially nasal rats. So it's where you shove a stick up your nose. But there's also saliva rats where you, test your saliva. It's when you're doing a rat, if it's one of the nasal ones, it's important that you do it right. And you can see on the screen there, I've got a big cross through the one where you shove the stick up your nose like this, because that doesn't work. Your nasal passage that you're trying to get in actually runs this way, like parallel with with the floor. So if the stick is going in level with the floor, then you're doing it the right way. So not up like that, in like this. And with the saliva ones, if you're doing a saliva one, it's really important that you do it as soon as you wake up. You don't brush your teeth, have a coffee, have a cigarette or anything like that. You do it as soon as you wake up. That's not so important with the nasal ones, but yeah. So just follow the instructions on the kit. But, just a lot of people are apparently getting that angle wrong. So we need to be careful of that. Next. Okay, the next thing that you can do to really keep yourself safe is stay outdoors as much as possible. Is anyone here running the whole of their program outdoors? If you are, maybe you could put a thing, raise your hand or put a note in the chat box. I would like it if some services someone said me, yay. Okay. Now, I'm going to read you the next bit. And the following information is taken from an ACTU fact sheet about ventilation. And they wrote it so well that we decided just to use their words. So COVID, as we know, is caused by the SARS-CoV-2 virus. The virus spreads through the air from infected people. So it's essential that every effort is made to remove and reduce any contamination of the air that we breathe. When we breathe or speak, we generate tiny aerosols that can't be seen by the naked eye. Inside, if the ventilation is poor, these aerosols accumulate and linger in the air over time. Just, a bit like cigarette smoke, but invisible. And people with new infections are most contagious, as I've said, just before they get sick, even when they don't even cough. But a cough or a sneeze or even speaking or singing generates significant aerosols. Speaking and breathing, are constant through the day. So over the time of the day, there's more aerosols lingering in the air than after, say, a single cough. And the longer we're indoors, the greater the risk of inhaling enough virus, if it is present, to be infected. Even vaccinated people have been infected indoors. So the answer is to spend as much time outdoors as possible where there is more fresh air. And as I said, for some family daycare educators, and I can see that some of you are saying, oh, we do it unless it's too hot, it could mean putting your entire program outside. And it's more important than ever to do this because the Omicron variant is so transmissible. There's more chance that you're going to get it than with the previous variants. So it's more important that we be outdoors as much as possible. And I'm noticing that some people are saying, yeah, but mosquitoes, or yes, but it's too hot. I think we need to put all of those things in perspective. There are ways of dealing with mosquitoes, never perfectly. I've got a mosquito bite now. But, there are ways of doing that, but it's still, the risk is less from things like mosquitoes or heat than for, of catching COVID. Next thing you can do is improve the ventilation inside. And as I've said, COVID is spread by breathing in contaminated air. So therefore, having clean air inside a house when you are providing family daycare inside your house is essential. So there's several ways to improve air quality. Obviously, the first one is to open up the windows. Yeah. So that by doing that, you're increasing the amount of air, outside air, inside the house. So open up your windows as much as possible. You can also improve the air quality by ensuring that any air conditioners that you use are well maintained and are circulating fresh air, or at very least not recycling the air. You can also use portable air cleaners. Someone's just said that they got an air purifier. So one of the ways that you can check on your air is to check if there's enough fresh air circulating, is to get a monitor that checks the levels of carbon dioxide. Carbon dioxide's the stuff that we breathe out, right? So there's always carbon dioxide in air, yeah? Where humans are or animals are. The outside air we breathe has about 300 to 500 parts per million of carbon dioxide. Carbon dioxide is also called CO2. And indoors, we need to keep the levels of carbon dioxide below 1,000 parts per million. The recommended levels are around 600 to 800 parts per million. So if you get an air monitor, you can look at the air inside and say, oh, this is good in my house. We've only got 200 parts per million or 300 parts per million. Or you can look at it and go, ooh, we're up to 1,100. That's really not good. The CO2 monitors are very cheap. You can get one for about $60, $70, and so if you're concerned about the airflow in your house, it's really worthwhile getting one of those. Those monitors won't tell you if there is any virus in the air. All they're just telling you is if there's fresh air circulating. Someone's saying, where can you buy them? Look, if you Google it, it comes up. Bunnings have them sometimes. There's a range of different companies that have them. Just Google it. If the monitors show that your house is an issue, that you consistently don't have good air in the house, it could be that you're providing family daycare from an apartment that has air conditioning and you can't open your windows. Then you might also decide to buy an air purifier. I noticed one person say that they're having it, that they've got an air purifier, that they've already bought one. Generally, they're between about $700 or $1,000. So I think it's probably outside the reach of most educators. And I think you're probably better off in doing those things like opening your windows, etc. But if you have a real problem with the air in your place, then it could be that buying one of those, investing in one of those, is the difference between you and the children getting COVID or not. I'm not saying, go out and get one, but I'm saying if you've got a real air problem, then that could help. You'll see them more and more in businesses and other public places. There's a bit of I know one of my clients tried to buy some in the last week, and there's quite a delay on getting them. They're like everything else to do with this, whether it's masks or rats or anything, they're in short supply. Okay, the next way that you can protect yourself is using the best masks and use them consistently. And they are definitely affordable. Now, I know that nobody likes to use a mask. I certainly don't, and I've never met anyone that does. It's not much fun breathing in your own carbon dioxide. They get itchy, they get hot. You feel, my glasses fog up. I begin to have panic attacks if I've got them on for more than about 3 or 4 hours at a time. but they really do work. They work by stopping you, if you have COVID, from breathing it into the air. And if somebody else has COVID and has breathed it into the air that you're sharing, then it stops you breathing it in. I think it's time, though, that we all upped our mask game. By that, I mean we have to get the best masks possible. Initially in the pandemic, everyone was making material masks and using those. And, certainly that's the sustainable option. But nobody should be using a material mask now. They're just not strong enough to stop that virus being transmitted or you catching it. So I've put it up on this screen. This is the order of which are the best masks at the top. The best ones are not in fact called masks. They're called respirators. And they look like masks, but they operate in a different way because they're so tightly fitting. They allow much less air to escape from them. The best ones are those called N95s or P2s. Sometimes you can get them online, sometimes you can't. Bunnings had P2 masks, they did too. Bunnings also have some of the KN95 masks, which I'll just show you my KN95 from Bunnings. That's my KN95. It's got some metal here, which makes a really snug fit under my glasses, and you'll see it's really tightly here. So that's a respirator that I'm using. I also have a Korean one, which is very pretty, and it's just like me. And I managed to get these online. It's printed, but it's not, it looks like, a material mask, but it's not. It's made from the same material. If you absolutely can't get either of, the N95 or the P2s or the Korean KF94s or the Chinese KN95s, then use one of these. But it's not your first choice. This is the surgical masks that probably a lot of you have. It shouldn't be your first choice because they're not as good as the others. I actually find these a lot more difficult to use now that I've been using one of these. This is a lot easier for me as a glasses wearer. And so it's worth investing a little bit of money. It's sometimes hard to find them, but if you can find them, invest the money to get the best mask that you can, and then use it consistently. Now, that doesn't mean you've got to use it, at all times. You are with children. When you're outdoors, you don't need it. I get outdoors and I rip it off immediately and breathe in fresh air because I'm sick of breathing my own air. But when you're indoors, you need to have them on you at all times because children can't get vaccinated. They haven't got that same level of protection that you have from your vaccination. And so you have to be very careful that you're not passing it on to children. Now, you could say, I've just done a rat test this morning, so therefore I know I haven't got COVID, so therefore why do I have to wear a mask today? Rat tests aren't as absolutely accurate as that. And you also don't know, you might have had it, you might just be getting it, and it's not yet showing on the rat. And remember, you're infectious for a few days before you show symptoms. So you might not test positive on a rat for 2 days, but meanwhile, you've got children climbing all over you, etc., etc. Okay, so next one is by physically distancing. Now, I know it's not possible to physically distance from a child. I've had children, I know what they're like, that they are climbing all over you, etc. They need you to hug them. You need to hug them sometimes too, but you do need to physically distance from parents and from other adults. you shouldn't be having parents dropping children inside. They should still be dropping outside. And I know that some of you go, oh, we did that last year, but now I've moved back to them coming in. Surely that's okay. No, it's not, because adults can pass on, COVID to children. So to protect the other children in your centre, there shouldn't be adults in your centre. I hope everyone knows that you no longer have to do QR checks into your family daycare service. You can abandon them, but you still should be doing that checking in outside. So that's how you keep yourself safe. Now we need to know how you keep children safe and their families, because their families are just as important as the children themselves. And the good news is it's pretty much the same as how you keep yourself safe. First of all, everybody should be vaccinated around children. So everybody should have had their double vaccination and that booster shot, because that's going to be the most positive thing for children, to ensure that while children can't be vaccinated, if everyone's around them are vaccinated, then that provides a ring of protection for those children. I think eventually we will get vaccinations for 0 to 5 children here. They're about to come in the US, and normally it's a bit later before we get the approval here. So there will be a booster at some stage. So, yeah. But, there will be a vaccination for children under 5, but there isn't at the moment. We also need to follow the rest of the rules for educators. So we need to test children when they're sick. If they're sick and they're over 2, they should be checked to see if what they have is COVID. They certainly shouldn't attend family daycare when they're sick. And, we protect them by staying outdoors and having well-ventilated indoor spaces, and making sure that the adults are vaccinated and wear masks. That's the primary things that we need to do to keep children safe. I want to talk a bit about excluding children when they're sick. Essentially, we know by now that children shouldn't come when they're sick. If it is COVID, then when they're sick is when they're most infectious. Yeah. The thing is, though, is that you shouldn't necessarily demand, your child can't come back until they have a negative RAT or a negative PCR. That puts a lot of stress on parents, and it doesn't necessarily show you that they're okay, because a child could have COVID and could test positive for weeks and weeks afterwards. That's why, people who have had COVID don't have to do RATs for another 4 weeks after having had COVID, because they may well still test positive. Work with your parents. If the child's sick, say, look, I'm concerned it might be COVID, how about they stay home for a day or 2 until we know for sure. And understand, though, that for parents, that's a very hard thing, because, it means they may not be able to work or whatever. So work with parents. If they've got, if you know that their child has allergies, if you know that they're allergic to, a particular pollen that happens at this time of the year, then don't keep sending the child home, because that runny nose is probably from the allergy, and you're just going to drive yourself and your parents and the child nuts in the process. Work with families about, your child doesn't normally have symptoms like this, and it is having tests now. I'm sorry, I think someone's saying it's probably good practice to sign in for QR codes. There's a list of businesses that have to sign in. We're not one of them, because there is other ways of tracking who's been in your service, like CSS things, attendance sheets, etc., rather than those codes. So yes, excluding children when they're sick. Okay, so it's fair to say that at some stage you have a positive in your service. You may have already done that. Who's already done that? Apart from themselves, who's already had a child in their that they're caring for, or one of the parents that they're caring for that's had COVID? Someone's saying, yep, we've had a few in our, a lot of you are saying that you have. Okay, so if you haven't to date, you're probably very lucky. And if you had, it depends. Someone's saying their own child. I'm sorry for you. If you did have, someone, come who had it in your service, then you'd know how you dealt with it. But one of the things is that the rules about what you have to do now are different than the rules in December, are also different than the rules at the beginning of January. So I always say that the best way to prepare, to deal with having a child with COVID in your service is to be prepared, because for those of you that it hasn't happened to so far, it will happen at some stage. So what do you need to do? First of all, testing and isolation is no longer mandatory. So you don't have to go, oh my God, there's a child, in my service that has had it. Everybody that is around that child has to be tested. That's no longer mandatory. It may be best practice, and I would certainly do it if I was a parent or if I was an educator that had been exposed to an infectious child. I'd be having a rat test, but it's no longer mandatory. Whereas before, the Department of Health in New South Wales said you have to all be, if you're a close contact, you've got to all be tested. Now they're saying you don't. It's only household contacts that need to be tested. But you do need to work out who's been exposed. Remember the symptoms, how long, the 2 days before the symptoms have shown, they're the ones that have been exposed. And you need to tell your service that, this child has come in and now has COVID. And either your service or you, depending upon what you've agreed with your service, need to inform the families that their children that have been there for those 2 days have been exposed to COVID. And again, it's that same letter that gets sent out to them. So I've then said, get tested yourself. Now, it's not, you don't have to get tested, but it's a very good idea. If you've been in a house or if you've been caring for a child, if a child's been climbing all over you and they have COVID, then I'd be getting tested. Maybe less so if it was a parent that was positive, because if you're doing the, meeting parents outside thing, then you'd be very unlucky to have caught COVID from them while you're both outside, meeting and greeting and dropping off that child to your service. You need to clean your environment. Now, this does not mean you need to go absolutely nuts with the Glen 20 and spray everything in sight. Remember the very first thing that I said to you about COVID being an airborne disease. It's more likely to be in the air than to be on surfaces. That said, we do now know that with the Omicron variant, it can survive on surfaces like plastic and glass for up to about 7 or 8 days. But I'm saying that to you because that's in a laboratory. They've said, okay, it can last that long. It doesn't mean that it's likely to. So if you've had a child with COVID in your house, do a good clean, but don't go overboard. You certainly don't need to get in special cleaners. You need to just clean as you would usually as a family daycare service that, prides itself on its infection control. So clean well, but not excessively. And your service needs to inform the department. So that's not your responsibility as an educator, but your service needs to do that. Okay, next. If you catch COVID, what are you going to do? Well, I'm sure that the first thing that all of those of you that said that you have had COVID did was panic, because that's natural. You've been hearing about this horrible disease for years and years, and finally you've got evidence in test results saying that you've caught it. It's natural to panic. And how will you know that you've got it? You will know either because you have symptoms or you test positive on a rat. If you do a rat test and it's positive, you don't have to get a PCR test, but you should do another rat. There is occasionally false positive, not very often, but there is. But you'll know you've definitely got it if you do it on 2 separate rats and it's positive both times. And you need to test every time you have symptoms, even if you think, is that what have I got? Is that a sore throat? Just do a test. And so for that reason, I'd say, get some more rats other than the ones that the department have supplied. I think every household should have a little stack of rats. Now, I'm not saying that they're easy to get. I know that they're really hard to get. I'm in exactly the same position as you are, trying to, order online and running off to the chemist that I think might have them. But they are becoming a lot more easier to get. So I think within the next week or two, we'll be past you can't get rats. I think they'll be a lot more easier to find. So I'd have that stack, and at the first sign of symptoms, I'd test. If you are positive, you have to let your service know. You've got to report your positive rat through the Service New South Wales app that I've already talked about. And you've got to tell families that you've been in contact with for the past 48 hours, or the children. Someone's just said they say keep in fridge. I've never known that you had to keep rats in fridge. We might check that with a bit later on, but I didn't know that one. So you need to inform your families by you or your service sending them that letter of children or families that you've been in contact with in the past 48 hours. And then you need to tell all your families, not just those, that you'll be closed for 7 days. And then anyone who lives in your home and you both need to isolate for 7 days. Yeah? And you need to take care of yourself. In that 7 days, forget about your family daycare service. Your families will all have been told you just need to take care of yourself. And to do all those things, treat yourself like a child that's sick. Look after yourself. Give yourself lots of hot drinks or cool drinks if you want them. Lie on the lounge and binge TV. Just concentrate on getting yourself better, because it is, a disease that, as we know, can be really, can be fatal. If at any stage during those 7 days you are worried because you can't breathe, because you feel significantly sicker, don't leave it. Contact your doctor as soon as possible, because the difference between being okay with COVID and being bad with COVID can be a very short period of time. So you need to do that. If your husband or partner or child catches COVID, what do you need to do? So if your husband or partner or child is positive, maybe we could go to the next slide, please. Then you have to isolate and cannot provide care for the next 7 days. And I know that there was some confusion about this initially because, oh, we're critical workers, we can soldier on. No, you can't. And I think the department's made this clear to people through an email. If anyone in your house has COVID, then you have to isolate for 7 days along with them. If on the 6th day, when you have a rat test, if you're okay, then you can come out of isolation the next day and start providing care the day after. But if you have symptoms, you've got to wait until all your symptoms are gone before you can provide care, and certainly before you come out of isolation. Yeah. So everyone in the household has to be symptom-free and out of isolation before you can go back to providing family day care. We know that family daycare is as critical as any other sort of education and care, but it's just too great a risk if someone in your household has COVID for you to be providing education and care from that same household with that same area. Okay, financial support. Now, I'd like to tell you that there's lots and lots of financial support, and if you get COVID, then you'll be okay and our governments will look after you. But unfortunately, there isn't. Unlike last year when the federal government did provide extra financial support, there isn't additional financial support. What there is you can, if you have to close, the only financial support that's available is the childcare subsidy proportion of the fee, or usual fees if parents are happy to pay. So, some parents may be quite happy to continue to pay you if you're sick with COVID, or if you have to close because somebody else, in the service has COVID, or a family member. Some might say, no, if you can't provide the service, I'm not going to pay you fees. Well, luckily, the government will allow you to still claim childcare subsidy. So there's 4 reasons that you're allowed to claim childcare subsidy and waive the gap fee. And those reasons are if you or someone in your household must isolate due to COVID-19. So even if it's only for, oh no, you've got rats now, so that doesn't matter. So someone said yes. Sorry, I keep getting distracted by these questions. Someone said, what about the $750 that the government will provide? In most cases, you will still continue to get that childcare subsidy, and that means that you're not eligible for the $750. You're only eligible for the $750 if you have no income coming in. So for most of you, we'll be getting just that childcare subsidy. So you can waive it for 4 reasons. So if it's you or any other member of your household has to isolate, if a child is at higher risk of severe disease from COVID, if you're minding a child that has cancer or an autoimmune disease, or, if for some reason it's not great for them, then you can waive their fees at any time that, they're staying at home because of the risk of getting COVID. It could be, also an Aboriginal child or a child with a disability. So if they decide not to attend, you can waive their fees. If you can't provide your usual service because a member of your household has COVID and you've got to isolate, then you can waive fees and get the childcare subsidy. Or if there's another lockdown, then you can I really hope we never have another lockdown. And I don't think our Premier would ever want to call another lockdown. But if there is, or if for some reason, if the state government says no one can go to education care or no one can go other than essential services, then you could also waive fees. And if a family chooses to keep their child at home, they can use their allowable absences, but they must pay a gap fee to the service. So if there's suddenly a lot of COVID in your community and some parents say, oh, look, I'm not going to send my child to family daycare until there isn't so much COVID around, then you can't waive their fees. They've just got to use their allowable absences, and you can, but they do have to pay the entire fee. So it's not great. It would be a lot better if the federal government was providing, more financial support. Oh, sorry, someone's just said, and they're totally right, and I forgot to mention it. In January and February, there's absolutely unlimited allowable absences. So if anyone over the last few weeks has used more than, even the additional allowable absences for these 2 months, it's absolutely, you can use, it's unrestricted. You can, they can be absent for the whole period, and you can claim the CCS for them. So, where are we? Next one. Oh, we're up to questions. We might, Elizabeth might come back now and take over.
Back. Thank you so much, Lisa. That was really fantastic. Lots of great information there. So thank you for presenting that. So for all of our participants this evening, we've now got a great, about half an hour of question time, and we've got a great panel with us this evening as well. We are actually going to be joined not only by Lisa, but we also have Glenda and Agnes, who I will introduce in a minute. Oh, here they come. Glenda's here with us. So Glenda is, and I think Agnes is coming now, which is fantastic. So Glenda Buckley, welcome. Thank you for your time this evening. So Glenda is the Executive Director of the Quality Assurance and Regulatory Service with the Department of Education.
It's not quite my title.
Okay, sorry.
That's okay, close. Sharon Goodoo's the Executive Director. I'm the Director of the Statewide Operations Network. So you might have got that when I was acting in her role. You got that.
Okay. Sorry about that. Thank you, Glenda, for the correction. Let's see if I can get Agnes's correct. So Agnes Bishop, Director Strategy and Projects with New South Wales Department Ed. Yep, fantastic.
Hi, everyone.
Thanks for having us.
Yes. Yeah, thank you so much for joining us. So to all of our participants with us this evening, this is a really great opportunity for you to ask all of your questions. We'd love to have you ask as many as you like. If there are any we can't get to this evening, we will be sure to send out some typed responses tomorrow. Now, while Lisa was talking, a lot of great questions came through, so I'll start with those and then I will go back to some that are coming through the chat box now. So we might start with that one that came through a little earlier about rat tests needing to be stored in the fridge. Can I put that to the panel if anyone has an answer on that one?
Glenda or Agnes?
Look, that's certainly not the advice that we've been providing. I think that there's a temperature range that they should be stored within. And I believe someone just popped it into the chat a bit earlier. So it's just normal temperatures. You wouldn't want them out in the heat, but we're certainly not providing advice that they need to go into the fridge. And we're not refrigerating them as we transport them, I can assure you of that.
Okay, fantastic. Thank you for clarifying. Another question that came through, if we do have a positive case at our service, would that need to be reported to the Department of Education or a CEQA? What's the reporting that's currently required around that?
Yeah. Did you want to talk to that, Agnes, or would you like me to?
Yeah, no, that's fine. Go for it, Glenda.
Yes, you do need to report a positive case. One of the changes, though, that we made relatively recently was We know that in some cases, services will have multiple positive cases. So if, for example, you have a child that attends your service and that child tests positive, then you do need to notify that initial case. If within the following 7 days you get a second or a subsequent child who tests positive, you don't need to continue to notify, because what we found was that some services, probably less so in the family daycare space and more so in the centre-based space, did tend to get multiple notifications, and they were spending large amounts of their time going through that process. So the guidelines have changed a little bit, but if you have an initial case, yes, you do need to notify.
But it is the service that's responsible for
it's not the educator.
notifying. It's not you
That's
guys
correct.
as educators, it's your service.
Yeah, thanks for that clarification, Lisa. You're right. Yeah.
Yeah. And also there is a requirement to notify through Services New South Wales. And we've also been working with them that there's actually a drop-down box now once you do notify a positive case, and the drop-down box will actually capture the early childhood family daycare service that you are actually, that the child is with. So that is for parents, so the parents can actually go in, click on the name of a family daycare service and just enter that in as well. Same with schools, if you've got before and after school care children.
Great. Thank you so much, ladies. So another question that's come through, if I feel that a child at my service is unwell or if they're presenting with symptoms, can I, as an educator, give them a RAT test?
No, that's something that you'd have to have permission from a parent to do.
Yeah.
And there wouldn't be much point in that, because if you've got a child that's unwell, you're going to, under your normal things that you do, you're going to call the parent and get the parent to come and pick them up. There's no point in knowing, 10 minutes earlier or not if they have a RAT test.
Yeah. And just also to add to that, the test that the department has sent out, we have had some people say that some educators are using them for the children. We have sent those out for the use of the educators or the staff of the service.
Okay, great.
I think there might be a bit of confusion there that some educators think that they are for the children.
Okay. Yeah, so that's great to clarify. This one might be for you, Lisa. A few people are asking, obviously, with the difference in financial support, can educators opt out from getting the CCS if they would prefer to get that government funding, that support payment? Would that be an option for educators?
Yes, but you'd have to talk to your service about that. The service would probably prefer that you claimed the childcare subsidy, because then they're getting their proportion of that. And it also means that you're not absolutely stopping being a family daycare educator for a certain period. Okay. I know that it might mean quite a difference in money to people, but it should only be a week that you're isolating. So you may just have to kind of go, okay, well, for this week, I'm going to have a smaller income, which is horrible, I know, and a lot of people, really can't afford that, but it is only for 1 week.
Okay.
I also think there's some doubt as to whether the federal government will keep that $750 payment going. So, yeah.
Okay, great. Another more, I guess, medical question. A couple of people are asking, are there any key differences in the symptoms between Omicron symptoms and general cold and flu symptoms? Obviously, we're, going to be going into winter in a couple of months. Are there any key differences we can look for, or are they're too similar?
I wouldn't be wanting to really give that advice, to be honest with you. I don't think any of us are experts in that space.
Yeah.
Yeah. So safe option is any symptoms, you would just need to get tested.
Yep.
Yeah. And as Lisa said, just follow your normal illness policies and procedures.
Okay, great. And another question from Mary, do I need to, if I get a positive RAT, do I then need to go and get a PCR?
No.
No.
You don't.
Okay.
The positive RAT, remember I said earlier, the positive RAT is proof that you do have it. There's occasionally, false positives. So if you really want to make sure, do a second one, but generally a positive RAT means you've got COVID.
Yeah.
No, I think the message that they're talking about in that respect, Lisa, is particularly if you get a positive RAT and you don't have any symptoms, it's wise to take a second test.
Yeah.
Okay. Another question that's come through, if a child who we look after gets a COVID positive result and they spend that full 10 hours with us of a day, so 8 a.m. to 6 p.m. In our care, am I and the other children considered as a close contact? And do we need to do a 7-day isolation?
So there's, did you want to answer, Lisa?
Oh, you can.
So there's actually no such thing as close contacts in education and care settings anymore. So I think Lisa talked about this a little bit in her presentation. I just caught the end of it. But essentially, there is no requirement to isolate or get tested. However, you do need to obviously notify families. Particularly if you have any symptoms, I would suggest taking a test. But unless there's a positive test, then no, you don't need to isolate.
Okay.
You certainly don't need to isolate, but of course, go and have a RAT test. Make sure that you're clear, or that if you're okay, because you don't want to pass it on to other children if you've caught it from a child. The law says you're not a close contact. We don't even have close contacts. You're not a household contact. But common sense is if you've spent 10 hours with a child inside a house, have a RAT test.
Yeah, I would agree with that, Lisa. Yeah.
Yep.
Great. Another one coming through, as a family daycare educator, does my whole household need to have a booster or just myself as an educator?
Remember I've said it's not law yet.
Yes.
Not yet. Yeah.
Currently, with your, being needing to be double vaccinated, it's everybody in your household over 18. So we, when it's brought in, we would think that it would probably be the same, but regardless, it makes sense for everyone in your household to be triple boosted anyway. Okay,
great. Some people just still wanting some clarity confirming that families no longer need to QR into the family daycare service. And I think, Lisa, you mentioned that.
Yeah, Glenda, could you answer that?
I think that's correct. Agnes might be.
That is correct.
Yeah, so there's no longer a QR requirement.
And someone was asking from when that came in. Do you?
Gosh.
In that horrible early January period?
Yeah, probably.
And I think some places are still doing it. I mean, but it's not a requirement. But some places, community, public places are choosing to do it. But, yeah, it's certainly not a requirement.
I think it was when all of those large sweeping changes came in as part of National Cabinet changes, actually, is when that all changed. Yeah.
So someone's just said we haven't been told not to yet. You may want to query with your service, and just say, look, the department said we didn't have to do this anymore.
We might get some comms out on that.
Yeah, exactly. Yeah. We'll do some clarification around that and get some comms out to all the services.
Great.
Just as a reminder.
Fantastic. Thank you. Another service-specific question. So I live in a 2-story house and my service is downstairs only. If my partner has COVID, can they isolate upstairs and I still operate?
No. Air travels, guys. It's still one house.
No.
And also because you're still a household contact.
Household contacts.
Yeah, great. Okay, I'm just having a look. See if I missed any. Is it still mandated that families still need to wear a mask at drop-off and pick-up times?
We would highly recommend it.
Everything is, yeah, I agree, Glenda. Everything's strongly recommended, but masks indoors, no requirement for outdoors, but where possible, absolutely.
Yeah, and the service might want to put their own policy in place around that.
Yeah, if I was you, I'd have that mask at the front door. I'd be putting my mask on when parents came, even if I was meeting them outside, and getting them to put it on. Everything we can do with a mask reduces the amount of either virus in the air or the virus we're breathing in.
Yeah. Can I just refer everyone to the guide on our website? So I just think the COVID guidelines are a really good platform for people to look at, and a lot of it is strongly recommended, but it will talk through things such as pick up, drop off, and give some really good guidance to educators around, some really good practice there in keeping everyone COVID safe.
I've often wondered this. Can I just ask everyone a question? Can everyone see the raise your hand function in the Zoom? Could you put up your hand? Could you hit that raise your hand button if English isn't your first language? Not many hands are going up. Maybe you could pop it into the chat box. If English isn't your first language, can you just, put the name of your language, etc.? My feeling is that...
Oh, we've got lots.
Yeah.
Lots of languages
coming up. So, and I think... it's great that so many people who have English as a second language are here tonight, and it could be that sometimes reading material is a lot harder for you than understanding spoken English. I could be wrong, but that's my guess. We've got a veritable world nation, every language in the world coming here.
Yeah.
I did notice another comment in the chat that popped up on my screen there that I just wanted to answer, if that's okay. Someone, I think, was asking about the $500 before and after school care vouchers and if they can be used in family daycare. And the answer is yes, they can.
Okay, great.
So your service has to register to enable you to be able to use that.
Yeah.
Okay, great. Another question that's come through for family daycare educators: will RATs be delivered to our home, or do we need to pick those up from our service provider?
Yeah, so the RATs are being delivered to the service providers. So I imagine that you will need to speak to your service provider about the arrangements for getting them to you.
Okay, great. Another financial question. So if a child has tested positive over the weekend and the child has to isolate, do they pay the gap fees while my service is still open?
No, if a child has to isolate, you can choose to waive the gap fee. Okay. You don't have to do that. Your service, or you could say, no, I'm still going to charge you, but you could say, well, if you can't come, we will waive the gap fee. But it's not an absolute, you don't have to waive the gap fee just because that child can't come.
Okay. Right. Let's have a look. A little bit of a complicated one here. So in regards to educator that has COVID and claims CCS component whilst their service is closed, what would happen to their family daycare children?
Can you say that again, please?
Sorry. So in regards to a family daycare educator, they've tested positive and they're claiming the CCS component while the service is closed. What happens with their enrolled children? How does the educator that's closed the service, you know, look after themselves financially?
I'm not sure I fully understand the question, but I think it's the service claims the childcare subsidy for those children and passes it on to you as the educator. That's, you know, that's the theory. Of course, that, you know, your service could choose not to do that, but most services will choose to do that.
Okay.
I think there was also a part of that, if I was listening correctly, that was about what happens to those children. So there might be a question about if your service decides to place those children with another educator, I imagine that would prevent you from claiming the gap fee.
I think that's what, they're getting at.
Yeah.
So if they're claiming CCS elsewhere, they, well,
correct.
obviously they can't claim it both. So what happens
That's right.
there? If the existing educator that's closed is claiming it, what happens to the new charge, I guess?
I think that would have to be a discussion with your service. So if they're putting
Okay.
them with a new educator, they can't double claim for the same child.
Yeah, that's right.
Yes,
Yep.
yeah. So definitely can't be claiming twice there. Okay. Just seeing if there's any more coming through.
I think we're presuming that most services wouldn't be able to place those children in another family daycare service.
Okay. Another one. So, would we be allowed to homeschool our own children if we're still operating family daycare? And that's if your children's school has closed because of COVID. So obviously working within the ratios and
because of ratios.
Yeah,
you know,
yeah.
unless
Completely.
yeah.
So there's no allowances, I guess, in terms of ratios for that to happen, even though your child's school has been closed because of COVID.
Yeah.
That's an arrangement the parent would have to set up, whether, you know, someone else somewhere else within the house maybe, but the educator should be caring for the children in care.
Yeah.
The enrolled children.
Somebody just asked about the $500 again. They said, what is the $500? The $500 is funding that the state government is giving parents to help them cover the gap fee to pay for their fees for after school or before school care. So if you have children who are doing before or after school care or vacation care, is that right?
Lisa, I'm not sure on the vacation care. I'd have to clarify that.
Okay, so let's say before and after school care. If you're providing that, then parents can get up to $500, which they can spend at your service to cover their gap fee. So it's not $500 for educators. It's for parents to help them cover the cost of their gap fees.
That's right.
It comes by way of a voucher, I believe, to parents of primary school children.
And it's up to the service to actually register for it. So unless the service registers, you can't use it. So the service must register to have the voucher system in place.
Okay, great. There's one other one that's come through. Where can I access those templates and communication method samples from educator to parent?
From the department's website. There's a big COVID section when you go onto the early childhood section, and those letters are within there.
Okay, great.
Yeah, we established that one pager so that everything COVID, so you don't have to go through our whole website in the early childhood section. As Lisa said, there is one specific COVID place and everything COVID is in that one spot. So hopefully that should make it easier. If any of you are struggling to find things, please call the 1-800 number and someone will talk you through that and, you know, help you navigate it.
Great, fantastic. Well, it seems like everyone's quite happy. Lots of thank yous. A really informative session. Is there anything else you ladies would like to share? Because it looks like that's the end of our questions.
I guess I would just like to acknowledge what a really difficult time this has been for the sector. And I think I heard you, Lisa, earlier just talking about the changing in messaging, and it has been quite horrendous, to be honest. And we've all had to adjust and move and flex and change our responses to things. But I think none more so than educators on the front line. So I just really wanted to acknowledge that and say thank you. And, we really recognise the important work that everyone's doing.
For sure.
Yeah, couldn't agree more, Glenda.
And we also recognise how difficult it's been for the department to try and communicate rapidly changing information for people. So.
Lisa, you literally cannot go to the bathroom and things change.
Tell me about it. People, we will try. I know that there's probably some questions that we didn't get to. We could answer all of those questions and do a great big thing like we did after the COVID session last year, but I'm thinking it probably won't be as valuable to people. If a particular question has been asked a number of times and I feel like there might still be some doubts about it, we'll send that out to people. But otherwise, you've got resources that you can use. Ask your service. You can contact New South Wales Family Daycare. I'm sure Elizabeth would love to answer some questions for you.
I'll be ready.
Or you can contact the departments. What's that number in case anyone doesn't know?
I'm in the car, so I don't have it on me right now, but Glenda might be able to. 1-800. Come on, Glenda, you need to.
Oh, my goodness, I'm not that
No
quick.
pressure. Hang on, I'll look it up on my phone.
Okay, so while they're looking it up, you can ring the department, but I think the first place that you should really contact is your service. And someone picked us up and said, oh, you mean provider, not service. We use the word service to mean your provider. And I know that's a bit complicated in family daycare, but yes, we mean the provider.
Okay, I've got the number.
Pop it in the chat.
Oh, you're popping it in the chat? Okay.
Yeah, 1-800-619 for those that are listening, and 113. Did I get that right?
Yay.
You did.
And
okay,
just with
so
that, Lisa, just with that number, we've actually improved our call system. So there is an option for you to press, I think it's 2 for COVID. So there's actually a designated COVID team that will actually answer those specific questions that we may not have gotten to today.
Okay, great. And I think the final thing that I want to say is just stay safe, really do your best not to catch COVID, because it doesn't sound like it's a fun disease to get at all.
No, it's not.
That's you speaking from experience, Ag.
Yeah.
Oh, I'm so sorry. Elizabeth, do you have anything else?
Yes, so thank you so much, Agnes and Glenda. We really appreciate your time this evening, and you've been great at answering all of our questions, so thank you. Before we leave tonight, I've just got one more slide of information to finish up. So if you do need to find out more information, you can certainly ask your family daycare provider. You can read the material on the department's website, and there's the link for you there. We will also, like Lisa said, we're going to send out some written answers, just of those really common ones that were coming up this evening. And as mentioned, you're very welcome to contact us at a later date if you think of anything. The PD in Your Pocket Facebook group is still live and still going, so please jump on there after tonight and share information, collaborate. It's a great opportunity for family daycare educators to come together and share information. So please join that Facebook page if you haven't already. Well, thank you everybody for participating. That brings us to the end of tonight's session. As I said, we're really hoping to get funding for another great year of Pete in Your Pocket, and we'll certainly keep you up to date of how that unfolds. So again, thank you. Have a wonderful evening. Thank you, Lisa, Glenda and Agnes. And we hope to see you all soon. Thank you, everybody, and have a great night.
Thanks, Elizabeth.
Thank you.
Thank you. Thanks, Lisa. Thanks, Glenda. Thanks.